Hello, this is Betty White, ARNP Digestive Health Specialist, and today I've been asked to talk a little bit about GI illnesses and diets. So as you all know, there's a lot of diets that are out in the publications now. They talk about FODMAP diets and gluten-free diets, carbohydrate-specific diets, and what are those and what indications do we have for giving people that information, and do those diets work? I would say for the most part we don't have great data behind diets and GI illnesses. We know that diet's important, right? We are what we eat, and that's true, and it does affect our bowel and the way we feel, and we know that skin issues and people can have allergic type reactions that aren't really true allergies but sensitivities. I think if you notice that you're having chronic abdominal pain, or if you're noticing stool changes and you've been evaluated to make sure that you don't have any diseases like inflammatory bowel disease or celiac, one of the things that you may want to talk about is diet. So some of the diets that we've kind of looked at for our patients, one of them being celiac diet. Now, celiac diet is truly a disease that is through biopsy of the small bowel, and that's gluten intolerance. But some people are gluten sensitive, and there's a blood test that can help identify that as well. Even if you don't have celiac disease and you aren't gluten sensitive, you can feel better on a celiac diet. And interesting enough, nowadays there's stores with celiac gluten-free aisles, right? So I know that all the big major grocery stores around the area, Safeway, Fred Meyer's, QFC, all have gluten-free aisles. And there's also a gluten-free store in Tacoma that's quite big. And those diets may help you, feel better. They may make your stools more regular, decrease abdominal pain and bloating. But again, if you don't have biopsy-proven celiac disease, then you probably don't need to be on that diet or be specific about that diet. People with true biopsy-proven celiac disease can't even have the smallest amount of gluten that may be in like a vitamin tablet. That can make them very sick and make them lose weight and have profound diarrhea. Another diet that's been mentioned in the news recently has been what they call FODMAPs, and it's FODMAP. So FODMAPs are really fructose malabsorption. And there's several different categories of food that may be deleted from your diet. Again, these are things that cause abdominal pain, stool changes, bloating, and gas. It's a common disorder. In fact, we probably see more people for that disorder than anything else. They are short-chain fermentable carbohydrates, and you can actually Google this. There are some good websites that we'll try to have linked with our website at Digestive Health that we can lead you at a good research and good information. But there's actually a food list that will be helpful. So things that are high in FODMAPs, I'm going to read from the diet so I tell you exactly. Things like fruit juices, soft drinks are really high in high fructose corn syrup, so better to drink things that are made with honey or agave syrup. Things that are high in lactose, so dairy products may be better for you to switch to soy products or almond milk. Things that are high, also nuts and coconuts. So there's a whole list of these different things that they've identified that cause gas and bloating, and deleting those things from your diet may help some of your symptoms. Again, the data behind this, they're starting to have some studies that look positive for people with what they call irritable bowel syndrome and bacterial overgrowth. But the data, it doesn't suggest that everybody is going to get better with these diets, probably about 50% of the people. But again, it won't hurt you to do the diet. They are hard to follow sometimes because most of the things that we eat have some high fructose corn syrup in them. So you have to be good about following the diet if you really want to see if it helps relieve your symptoms or not. And then another diet that has been mentioned is the carbohydrate-specific diet. So that's a diet that's supposed to be specific for you, and I think it's based on a blood test. You have to get your blood drawn to see if you're type A or type O to really make the diet work the best for you. But again, I think it's eliminating a lot of the same things that the FODMAP diet does, and it's very consistent with another diet called the paleo diet, P-A-L-E-O. And the paleo diet, again, is back to basics, really. So eating meats that have not been treated with antibiotics or steroids, and then eating raw fruits and vegetables. Again, people with specific abdominal pain may not tolerate as much raw fruits and vegetables as most of us. So again, I would suggest if you do choose one of these diets to go to, that you start out slow and make the changes slowly over a couple times or even a month, so that you don't cause yourself more abdominal pain or stool changes that can be seen when you make a specific change. Your body gets used to what you're eating, and so if you make changes like that, they may cause you even more problems. The one thing I would say with any diet, again, the data behind diets aren't great, because it's very hard to keep people on specific diets and evaluate their symptoms because there's no laboratory markers or CAT scan that we can say, hey, this person has more abdominal pain, this is what their CAT scan looks like when they're doing this. But your symptom relief is really what you want to evaluate, and keeping a food diary would really be helpful, along with what you eat in a day and what your symptoms are, and doing that over about 3 or 4 weeks. Again, those are hard to do because you have to do it every day, all day long, or else it's not going to be as helpful as we'd like it to be. Speaking with your primary care provider or your gastroenterologist would be very helpful. They can help lead you in the right way and what diets have been most useful for most people. So again, if you have changes with stool pattern, abdominal pain, bloating or gas, things that are bothering you more than a week or two, you need to get in and get evaluated. We wouldn't want somebody going with those type of symptoms for an extended period of time without either stool tests or possibly colonoscopy if indicated. We can also help refer for dietitians or nutritionists if needed, if you have a specific diet issue. We will have information attached to our website, dhsgi.com, for more diet information. Again, this is Betty White, ARNP, Digestive Health Specialist. Thank you.